we're going to be talking about the hips and the entire pelvis. So I don't have enough hands here, but the pelvic region is composed of two of these general pelvic bone units, and then the sacrum fits here in the middle, and then they're fused here, not actually together, but with the pubic symphysis, and then they're also attached for where the femur goes. So if you just kind of think about your pelvic cradle down in your lower self, you can figure it out. Now, so this is my right one, this is my left one. All the diagrams have the right one, so this is the right. Now, when we're talking about the whole pelvic bone area, this unit here is called an os coxae, and there's two of them, but we're only going to talking about one. It's a fusion of three different bones, but this isn't in an adult. They're all fused as one unit. So this upper portion here, this is the ilium, this here is the ischium, and this here is the pubis. So three different bones all fused together to form this pelvic unit. So we're going to be talking about it from previously. We've had like anterior and posterior views. Well, since most of the action is happening where on these bones, not in the front and the back, but on the sides, so we're going to be doing this medial view versus the lateral view. So the medial view, when you're looking at the pelvis from a medial angle, so this would be like if you were looking at the inside, the side that's closer to your belly button. So right there. So this here, you should see one large opening. On the lateral view, you should see the large opening and this portion where the hip goes, or the femur would connect in. So we'll talk more about that in a little bit, but let's start on this medial view, and we'll look at, we're gonna talk about the ischium. No, we're not. We're talking about the ilium first. The ischium is down here. So the ilium is first, this portion up here. So let's start with letter A in the handout. Says the iliac crest. The iliac crest is only visible on a lateral view. So here's your lateral view, and it is this part here. It's not the ridge. It's this ridge right down here. So if you think about this, the crest, like this is what you would kind of see. Like there could be an avalanche coming off of it. If you've been out west, you might see that. So it's on this portion right here. This is the crest, not up here. It's this rough part right here. So this is the iliac crest, only visible on a lateral view. Next, you have the iliac fossa. So the iliac fossa, you're going to be on a medial view, and your iliac fossa is this whole region right in here. So this is the fossa right there. It's very large. So it's very smooth area. So that's the fossa right there. Medial view, fossa. Now, the anterior superior iliac spine. So here we are again, medial view. Anterior, front, so front, superior, top. So the anterior superior iliac spine on the medial view is this part right here. So here is your anterior superior iliac spine right there. So it's a spine. It's not just a ridge. So this is the spine. Then you have your anterior inferior iliac spine, and that's this curve down here. So that's your inferior, not greater or less, just this one's superior, this one's inferior. Next, let's switch over to the posterior. So to get the posterior, we're going to need the lateral view. So now the posterior, this would actually be the posterior. So we're going to get it from our lateral view though. So if you think about, this is the actual back. So this is the region where we're going to be looking at. But so from the lateral view here, we have our posterior superior, which is going to be this one right here. Which is different than the crest. Here's the crest. So here's the spine, posterior on your anterior side. Whoa, way over here. All right, so here we are. Posterior superior iliac spine. And then you have your posterior inferior, which is this one. It's not very notable on this one, but it's down in here. Before you get, let me see if it's better. I think it's better on this one. This is a left one, so it's going to look different. But from your medial view, this would be your superior. Here's your inferior. There's your crest. So it's a little bit different on the left one than the right one. But so here's your superior. Here's your inferior. Again, it's not as well marked on this particular bone, but then you have your greater sciatic notch. That you're going to need to be on your lateral view, and it is this. Make sure I tell you this right. Looking at it. So superior, inferior. Yes, this, again, it's not very noted right here, but this is where the sciatic notch is. It might be a little bit easier to see. Now you can't see it from the medial view. But so this is your sciatic notch here. Not that great to see. My phone's ringing in my house. Alright, and then you have your auricular surface. So we're going to need to be in our medial view. So here is our medial view. So our auricular surface is going to be the part that looks like an ear. So that would be this part that looks like an ear. It doesn't really look like an ear that much to me on this model. It looks a little bit more like an ear on this model. But, so here we are. We're on our medial view, kind of this rough portion down here. So the auricular surface, and then the acetabulum. This is the part where the femur actually inserts this entire socket here. And one of the things about the acetabulum is up here, this portion of it is the ilium. This back portion is the ischium, and this portion is from the pubis. So all of the pelvic bones are actually fused within this acetabulum cavity, and that's where the femur connects. So those are the parts of the ilium. Now, let's move down and talk about the parts of the ischium, which is this portion, and the pubis, this portion. So let's talk about the ischial spine. So the ischial spine, we need to be in lateral view, and it's this protrusion right here. This is the ischial spine. So there is the protrusion. Now, you also have the ischial tuberosity. The ischial tuberosity, you're going to be in lateral view, and it is this portion. This is what you sit on. So if you the yoga that I tend to do, they talk about your sits bones, and so it sits, S-I-T-Z, not like sit. But anyways, it's what you sit on. So if you actually just sit down, and they'll tell you to just kind of make sure to ground yourself. You can actually feel them when you're sitting. Just like sit on your hands. It's the part of your bones that are actually touching your hands. You can feel them. So that is your ischial tuberosity. So this portion right in here, that's what you're actually sitting on. This is what supports your weight. If you're interested in doing labor and delivery, post delivery, a lot of times they'll recommend like a sitz bath. That doesn't mean fizzy or anything. It's referring to this region. So just kind of bathing that region with a soak or a bath to help with some of the healing. So sitz bath, sits bones, ischial tuberosity. On the test, you should put ischial tuberosity. But when you're talking to people, you can call it the sits bones. All right. Now, you have the lesser sciatic notch. Remember, the greater sciatic notch is up here on the ilium. So the lesser sciatic notch is also on your lateral view. This portion under here. So this is your lesser sciatic notch because it's directly under your ischial spine. So there's a little bit of space here. This is going to be your lesser sciatic notch. Now let's go into the pubis. So the pubis would be this bone right here. Kind of hard to do this in a mirror, but anyway, so here we are. This is our medial view. So our superior pubic ramus is the part that's the upper portion here of the pubis bone there. And then you have the inferior pubis ramus, which actually kind of connects down in here. So these bones are fused somewhere right in here. You cannot see it on this model, but you can see how they are in the book. So this is your superior, this is your inferior, and they're both called each one is a ramus. Together they're rami. So there's that. Your pubic symphysis, I'm not going to have, but you would know. So if you have these, I'm going to try to hold these, but I don't have large hands. But so if you have these, your pubic symphysis is going to be the portion between here that connects that fibrocartilage disc, and then so kind of between this portion here. So that's where that would go. So since I don't have a model for it, you're probably looking for a picture. All right, that's where that would go. The pubic arch would be how the angle is below the pubic symphysis. In males, it's going to be acute, so it's going to be a small angle. In females, it's going to be a little bit wider, and that helps. So females have a little bit wider hips, helps during childbirth. That's one of the things that forensically they'll look at: is this a male or a female? Is that angle between these below the pubic symphysis? So if I had to guess, I'm going to say this when I put this up here. This is probably a male, or model of a male. And then the last part on your coxae components is the obturator foramen. That's what this is. This is very large. This is the obturator foramen. So remember, foramen, large hole, large opening. So that takes care of the pelvic region skeleton.